Hey all, we're going to take a look here at some thoracic radiographs of a cat. This is a 12-year-old male castrated Bengal who's presenting sort of ADR, just ain't doing right, and has a history of anemia. So on these thoracic radiographs, what we're seeing is that the cardiac silhouette is just a little bit big, and cardiomegaly can be really challenging in cats to identify. Oftentimes, remember, cats' underlying heart disease is hypertrophic cardiomyopathy. So even when there is heart disease without significant atrial enlargement, sometimes the heart can even look normal. I think in this instance, there's enough evidence to say that it's a little bit enlarged. It's spanning at least 3 and maybe a little bit more intercostal spaces. It just looks a little bit rounded in the ventrodorsal projection. Otherwise, these radiographs are pretty normal, and so the pulmonary parenchyma itself is normal. There is no evidence of significant bronchial disease. Oftentimes, this is another challenging feature of cats, is sort of when to call the bronchial pattern and when not to. So we can see a few bronchial markings within this caudodorsal pulmonary parenchyma, and similarly in our ventrodorsal projection, we can see some changes there. But overall, these lungs are pretty normal. Pleural space is pretty normal, no pleural effusion, no masses, and the mediastinum's normal. There's no evidence of lymphadenopathy. So ultimately, this is a cat that will sort of give the subtle finding of mild cardiomegaly, and that's where the next step needs to be what the clinical consideration is. Does the cat have a murmur? Is it presenting with any sort of tachypnea or anything like that? And we might do a bit more of a cardiac workup, an ECG, an echocardiogram, and that kind of thing. So that's been a review of some pretty close to normal with a subtle abnormality thoracic radiograph, and I hope it helps.